Okay, so I'm not seeing more attendees, so I'm just going to begin. I'm going to give a little bit of an introduction to myself, and then I'll have Dr. Cost introduce himself as well. So if those of you that don't know me, my name is Rubina. I'm an academic recruiter with Aspen Dental Management. So we're the support organization for Aspen Dental, which are our offices where we have our dentists work in those, and all of our practices are owned by doctors, just like Dr. Cost. So we're here to support them with recruiting, HR needs, marketing, so that all of our doctors can focus on what's most important, which is patient care. So we have a question and answer box on the bottom. So feel free to type in any questions you might have for Dr. Cost regarding anything dentistry. He also is a West Virginia alum, so feel free to ask him anything regarding that too. I also will be looking at a screen over here and looking at questions that you might have submitted prior to. So if you see me looking over there, it's not because anyone's over there, it's just there's another screen and that's where all your questions will be. So I'll be the moderator, and if you have any questions that you want to ask privately, you can choose that in the question and answer box, or you can indicate that, and I can email you afterwards and answer those as well. So without further ado, Dr. Cost, if you could just give a brief intro.
Sure. Welcome everybody. Appreciate you guys being on. This is really just a very informal kind of Q&A session. So just, answering any questions you have about, the world after dental school, what that might mean, be it at an Aspen practice or a private practice or whatever, questions you may have, just to kind of give you, a little bit about the real world and kind of what to expect. I am a 2007 graduate at WVU School of Dentistry. Been doing this for, 14 years now, somewhere in there, 13, 14 years. I've worked in a mix of private practice and now own several Aspen locations, working on number 6 right now. So I have a lot of doctors that work for me, and we have a pretty big organization at this point in the state. So do a lot of procedures. Just about everything can be topic of conversation. So if you have any questions about anything, pretty much ask. I'm a little bit of a jack of all trades, so I can answer a lot of that. Anyway, but if, ask anything.
Perfect. So I just had a question right off the bat. What options did you look into coming out of dental school, and why in the end did you choose Aspen Dental?
Well, coming out of school, it's sometimes it's tough to find a job. Sometimes it's not tough to find a job. It just depends on maybe where you're going. Some states have, obviously different requirements. We know, how North Carolina and, New York and Florida, they're all, kind of crazy places when it comes to that. So, finding a practice is kind of the thing, whether, and be that private practice or, Aspen or another, corporate per se dentistry. We're not really as corporate as everybody thinks that we are compared to a lot of the other corporations out there that do that, because we're all individually owned. So my journey was, private practice for, gosh, I don't know, probably 3 years. And then I was at, 3 or 4 years. And then I was at another private practice for probably another 3 before I joined Aspen. And, things just didn't work out one way or the other. There's a lot that goes into private practice when you're, when you're an associate. It's pretty easy. You get, a cut of your, production usually is how that works. And, then when it comes time to buy the thing, there's a pretty large expense, when it comes to that. I will tell you the big pitfall, and I've had a lot of doctors that work for me that have been through this. The biggest pitfall that people will see coming out in private practice is when they come into an associateship, they don't really ever get a evaluation of the practice that they're going to. So a lot of times you'll get somebody that'll say, hey, I'm bringing you in to help transition this to you at some point, and I'm going to sell it to you. For some reason, old dentists have a really hard time letting go of things, and you'll find that out there. So you may sign a contract, you're not going to value the practice, and then you're going to come into the practice, and then you're going to add a ton of value to it. when you're there, and then they're not going to let go of it, or they're going to say, "Yeah, we're not going to have you, buy it just yet," or whatever. If you can find a really nice place that's a smooth transition, then that's awesome. That can give you, something to, the ideal in a private practice is to come in, be an associate for a little bit, transition so the other doctor is the associate while you take it over, and then they ride off in the sunset and you stay there. That's everybody's ideal, but that never really happens. It rarely happens, and there's a lot of people out there that have really negative stories about that. So you just have to be really careful with that. The other real difference that you'll find too is the way that you're paid a lot of times, which is, everybody's big thing. You're coming out of school, you got loans, everybody, has that. And that's, that's a big, worry, because they're going to start kicking in and that kind of thing. And rightfully so. You guys have worked really hard. I know you guys that are D4s, are on the final stretch, and I know COVID's been a real, crazy time, and it's going to be hard to get requirements and things like that. So you guys are going to be really, kind of struggling maybe here or there, but I would encourage you to get through that as quickly as you can. We'll get back into that in a minute. But when you come out, you want to find something that is comfortable for you. That's the thing that I would say, more than anything else. Pick a place, be it Aspen, be it private practice, be it whatever, that you're in a comfortable situation work-wise, so you can, focus on patient care. I'm not a huge stickler on the money, when it comes to that. We're a business, everybody's a business, and, people understand that you pay a service or pay a fee for the service that you're going to get. But you have to treat the patients the right way. And you guys know as well as I do, you probably have a lot of patients here and there that might not be the happiest patients. That tends to happen sometimes too. You can't be everybody's provider, when it comes to that in life. There's people out there that just don't mesh, and that's okay. But you want to try to have good patient care and good goals and good, just a good philosophy on how you want to practice and how you want to do life, when it comes to that. And if you do right by that and you hold true to your standards, the money's going to follow and it's going to come. So when you're coming out, basically you have that choice in front of you of, what do I want to do? Because money's always the biggest thing, like back to that subject. And when you join a private practice, a lot of times you'll join as an associate, and you'll, usually get 20-25% maybe of your production. And that's going to be production after insurance, usually. So it will be like a net, after the fact. So it's not going to be all of the production. It's going to be the production after the insurances are paid out and things like that. So, but what you'll find is if you get into a situation you might not know or might not know the person, is a lot of times you're going to be doing a lot of the grunt work. You're going to be doing a lot of the fillings. You're going to be doing a lot of the bread and butter dentistry, as we call it, which is good, in some respects, because, I like to call it a restorative base, that you guys can really, really grow as a good clinician at that point. So you do need some of that, but it's also a lot less money for those things. And a lot of times the person that's the owner of the practice is going to cherry pick the procedures, and they're going to get, a big crown and bridge case or a full arch rehab or, an implant or whatever the case may be. Okay. And they'll make their money on that. And then you're just going to get paid on what you do. So sometimes it's a little bit difficult. I was in a really good situation when I came out. I was in a private practice, and I had a mentor in my private practice, just like I try to mentor, people that come through my practices now, who actually helped me learn to do implants right off the bat, and helped me learn to do arch rehabs, right off the bat. I watched a lot, I saw things just over and over and over again. Think back to the first time you guys had a big procedure. How many of you, and you can virtually raise your hands here, how many of you stayed up kind of all night long, not sleeping real well, thinking, oh gosh, I've got to get the, the blue white first. I've got to, have this polyvinyl ready. I got to, have this case mounted ahead of time and everything ready to go. Hopefully nobody has to use a water bath anymore, but I know you guys have to in school. You won't in real life. But just, all the steps, you'll go through them in your head over and over and over. And maybe your first, 6 months, a year out of school, you may do the same thing. Eventually you'll get to the point where you don't do that because you feel comfortable with the procedures that you like to do. So that's, something, finding a practice that is something that you enjoy doing, things that you enjoy doing, so you don't feel out of your element. Also, it's good to push yourself. It's good to, and that's where having a mentor comes into play, because if you can push yourself a little bit and have somebody there that can kind of, pick up the slack. If, say you want to learn a little bit more about surgery, or you want to learn a little bit more about molar endo, and you're not real comfortable with that. If you've got somebody there that can help you and get you out of the jam, so to speak, for your first, 6 months to a year of practicing, and help you grow, then you're going to learn to do it. And that's what I had when I got out of school, and I was really lucky to have that in private practice. When I transitioned to Aspen, it was really a case of, I was ready to buy the practice that I was in, and the guy was like, gosh, I don't even know, 65 probably still, and had just built like a brand new building, and he was asking way too much for it, for what it was worth. It wasn't valued for enough, and there was a whole big, debacle with that. So I just said, hey, I'm gonna transition to something different, and found Aspen, and really fell in love with the patient care goals, and they meshed well with me. So I took that over, and I purchased, a practice, and now I'm, purchased number 6. So I've got a lot of doctors that work for me and mentor. So that's kind of the long answer to get to how I got there. But, certainly it's, there's a lot of that, because when you're looking at practices, you have to kind of have an end goal in mind a little bit. Okay, the first job may not be the job you stay in. Just know that. But you may, think about an end goal, kind of where you're at, and you got to think about the different values of what you might be transitioning to. Okay, and we'll talk a little bit more about partnerships and how to buy private practices, that kind of stuff, if you guys have questions on that.
Going along with, you talking about owning practice at Aspen, someone just asked, what percentage of the practice does Aspen own versus the doctor? And then a follow-up with that, also, is it true that once you buy into Aspen, you can't leave or sell your shares?
Okay, so probably misnomered on some of this. So all of the practices. Okay, so it's kind of a business services partnership kind of thing that we do together. Okay, so Aspen is the brand. ADMI is the Aspen Dental Management Incorporated is the name of the company that helps manage. If you look into and you look into a lot of high-end private practices, a lot of high-end private practices will have somebody that they pay to come and help them streamline their production, streamline their business, help with marketing, help with those kind of things. There's a really high-end dentist in Bridgeport, does the same thing. Really good guy, and he pays somebody that weekly is in and helping him do these things. Sometimes practices will say, well, we're going to go and we're going to do a course, and we're going to get with these people, and they're going to help us try to streamline things, and they'll do that, and then they'll follow up maybe a couple weeks later to see if people are having morning huddles and whatever, and then you never hear from them again. The thing that ADMI does, which is really, really nice, is they're there to help with the stuff that you don't want to have to deal with. So you don't want to have to deal with filing insurance claims. You don't want to have to deal with trying to collect money on things. You don't want to have to deal with trying to set up care credit for your office. You don't want to have to deal with recruiting people. You don't want to have to deal with all of the stuff that is the extra stuff that's not dentistry. There's a lot of that. So they do a lot of those things and are really, really helpful with that. They help get new patients in the door. We have places people can call pretty much at all hours to help try to find a dentist to help come and try to get them try to get people help when it comes to that. But there's a lot of services that they help provide that allow me to practice every day, help people, mentor other doctors, have those kinds of actual dental, things that you want to do versus, focusing on other stuff. So I'll give this example. I have a doctor that works for me, and he was in private practice for, I'd say, probably 18, 19 years. He was embezzled from twice, I think. I don't know a dentist actually out there in private practice that hasn't been embezzled from at least once, but he was embezzled from twice by somebody that worked for him. so he got to the point where he had to do all this stuff himself because he got tired of all of that. So he worked from, he went to the office, I think about 6 or 6:30 every day to get ready for the day, to open up all the stuff and get all the things ready. Did dentistry from like 7 o'clock in the morning until like 6 o'clock in the evening. And then he spent from 6 o'clock in the evening until about 10 or 11 every night finalizing his books, doing insurance, trying to get stuff out to, for payments, trying to, get all these things together, all the administrative stuff to do, because you couldn't really count on somebody else to do it. So it's hard, when it comes to that stuff. So it's really a partnership with that. Now, as far as the practices, I'm 100% the owner of my practices. So all of my doctors work specifically for me. Aspen is there to help, with the marketing. They're helping, they're there with the brand. They're help to get patients in the door. They're going to help recruit and do all those things like we talked about. And then, there's a cut of the money obviously that they get, and there's a cut of the money that the doctors get. But all of the money that kind of, it's basically like balancing the books of any practice or any business that you're going to have. You have to take out all your expenses. You have to take out your rent and utilities, and you have to take out all the supplies. And we all know that general dentistry is a very supply heavy, office, when it comes to that kind of thing, because there's just a lot of stuff that you have to have for dental. And you guys know from central sterilization and from all of the stuff you have to buy in the store and how much stuff costs when you have to go buy burrs and this and that. But there's a lot of stuff that you have to buy to own a practice, or, to run a practice effectively. You have to have stuff to do it. So, all that stuff, all that money will come out, to a certain point. And then, we'll get a cut of that, and then the doctors will get their share of that. So, so they have a percentage that they get. I don't know if I'm really at liberty to say what that is actually, but it's not as much as what the doctors get. I'll say that. But it's a fee that I pay them to help run that. And they have to have that to help run that, and that helps do lots of things. It helps do the recruiting things. It helps do lots of different things. What was the follow-up part of that question? The second part.
It's once you buy into Aspen, you can't leave or sell your
Oh
share.
no, so that's not true. So, so as an associate, or so the hierarchy basically is this: when basically new graduates and people that don't have as much experience sometimes come in as an associate role. Okay. And I'll talk about how we pay people and do that kind of thing here in just a second. But there's an associate level, and then there's a clinical director level, which is above that, which kind of is the manager of the practice. And then above that, there's the owner level, which is what I have. I have again, starting the 6th practice, I have one partner in one of my practices, and the other practices are just have clinical directors, and I'm wholly the owner in those in those offices. As an associate or as a clinical director, there's no, if you come to work, there's a sign, whatever that's called, a letter of intent or whatever that we sign, that doesn't hold you to any kind of what's the thing where you do the.
It's not a contract; it's a letter of agreement. So
a letter of agreement. Yeah,
you're not bound to us.
Yeah, exactly. So the way we really think about it is, you either want to be there and love working there, or you don't want to be there and you don't love working there, and it's going to be okay either way. If you sign on and you're part of that, there's nothing saying that you can't work right down the street. There's no I forget what the name of that is, where you can't work
like a radius.
the agreement thing. You don't have to do that. A lot of private practices, once you sign on the dotted line for that, you have to be out of the area for 2 years or whatever it is. They'll give you a time period where you're not allowed to be within 30 miles of that city or whatever, and it'll get a little bit bigger if you get into a more rural area where they're the only dentist. If it's the one, I think I did my rural rotation up in outside of one of what's the ski resort up there, Canaan Valley area, and Davis, did it up there, and that was the only dentist in like 3 counties up there. So if you're if you're a place like that, sometimes it might be a couple counties you're not allowed to be in, so, but that's not true of any associate or clinical director level of that. Now with partners, that gets a little bit different, because you're buying in to that, and that's a partner buying into my share of things. So you're buying into the business, and we're partners together. But it's all, wholly owned by the doctors, when it comes to that. And if, there's clauses and stuff that you have with partnerships, but even if my partner wanted out, yes, I would buy him back out. so there wouldn't be any way that, you're just not going to be stuck somewhere, that kind of thing. But on a general associate level and a clinical director level, there's nothing saying that you have to be stuck somewhere or, having that, restriction on.
Right. So like if you retire, are you able to sell, your Aspen practices back to Aspen Dental?
Probably at that point, I guess you could, but at that point, it would likely go to another doctor in the practice, I would imagine. It would, we would say, who's interested in, taking on this role, that kind of thing, and, dividing up percentages, or, somebody buying, multiple offices or whatnot.
Right.
So there's lots of different ways you could do that.
It can also be passed down if your child is a dentist. It can be a
Yeah,
legacy
good
thing and
idea.
pass it down. As long as they're a dentist, you can pass it down to them.
And different states have different rules for that. The state of West Virginia, you have to be a dentist to own a dental practice. The state of Kentucky, you don't have to be a dentist to own a dental practice. So there was a lot more early, corporate type places in Kentucky where people were just, managers that bought things.
Right.
I had a guy that used to work for me that was a hygienist, and he lived way down in like the eastern coalfield mountains of Kentucky, and he owned a dental practice and paid a doctor to come and work for him.
Wow.
You still have to follow the rules of being, having, the doctor do that kind of thing. But, but in the state of West Virginia, you certainly have to be a dentist to own a practice, and most states are that way.
Yeah, definitely. So this is a little bit, it's not a question, but it's just a thank you to you. As someone whose wife, I think, is now working for you in Parkersburg. And they just wanted to really thank you for training her and making her a better clinician, and they really appreciate you.
Yeah, for sure. Yeah, she's come a long way, for
Awesome.
sure.
Awesome.
And still moving forward.
So another question is, do you feel like students will be ready to work at Aspen fresh out of dental school, or do you think it's more advantageous to gain more experience beforehand with a GPR or AEGD? Essentially, is it an easy transition from dental school to Aspen?
So it could go either way. So it just depends on how you want to do it. I've got doctors that work for me that have done both. And again, it depends on what kind of practice you fall into. So, my journey again was coming out, being in private practice and learning, right. And I had a really good mentor that, I started going to implant courses right out of school, and, back 14 years ago or whatever. So, we were really hard into it, and, learning, big with the perio, big with, lots of different things, just went to lots of courses and learned a lot of things. And if you have a really good mentor, sometimes that's almost as good as a GPR program, depending on what you're doing. Sometimes you guys, understand this, there's a lot of hurdles to jump through with the academia part of things, right? So yes, you're going to learn certain things. Some things you're going to, it's going to be like, this is, do I have to do this? Do I have to do that? And, you may not learn the real way to do it till you actually get out and do it. I've had doctors, that have come through the, the programs, be it up there or other places. I've had doctors that have done GPR residencies. I've got one that's going to VCU to get hers. I've had another doctor that's going through the oral surgery residency, the preliminary one, the first one that you do in a GPR up there. So there's lots of ways to do it. And yes, you come out and do have some more experience doing that. I also have, doctors. I have a recent grad that has just come and started working for me. She's super great, and I don't know if you guys know Catherine Ransom. She was last year graduated. She works for me now in Clarksburg, and she was like, I don't really know that I really like extractions, this or that. She, came down to me, and she spent probably 4 or 5 weeks with me. And she loves them. She does all kinds of surgery now. I taught her to lay flaps and do surgical procedures and do all kinds of crazy things. And she really is grown a lot. And she said, man, if you'd asked me 4 weeks ago, she was texting with all the people in her class. She said, I'd never thought I'd be doing this. And, so it just depends on what you like, and you don't have to like everything, you don't have to necessarily like extractions. You don't have to like molar root canals if you don't want to, but it does help market you. If you want, if you're good at those things, or you want to learn those things, or you want to challenge yourself, whether it's a GPR program, whether, it's having a mentor, whatever that is, certainly it can be helpful to do that. CE courses are super duper helpful. when it comes to those things. And we offer a lot of CE free through Aspen as well. We have a whole website that is basically just for doctors, to go do free CE and things like that. And we host lots of internal stuff that is, implant driven and endo driven and all those kind of things. And, we did a big 70-hour, implant course this past, over COVID. So, there's a lot of stuff out there and a lot of opportunities. There's no right or wrong way to go. I would just, I would encourage you to try to find the right place, for what you're wanting to do. If you feel like you're somebody that wants to challenge yourself, finding a mentor that's going to challenge you, or finding a program, a GPR program, things like that are going to challenge you to learn more, or a grad pros program or things like that are going to certainly help, teach you more, when it comes to that, when you're dealing with, restorations or, implants or things like that. If you go somewhere that's, they do fillings and crowns and they, send out all their endo and they send out all their extractions and that's all they do, you're not really going to learn a lot. And there's a lot of dentists out there that do that, and that's okay. If that's what you like doing and that's your thing, super great. It's not a big deal. I've got a buddy that graduated the year that I did. He's got a really successful practice in there here in the state. Doesn't do extractions, doesn't do endo, doesn't do any of that stuff. And he does pretty good. He just doesn't do a lot of stuff. But he sends a lot of it out. So it just depends on what you want to do and to challenge yourself.
And going along with that, with the training and everything, we have a whole training program along with the CEs for our associates that start off. We usually have a 4 to 6 week training program. If it's not in the office, we send you to Chicago or Syracuse, where you get to work with a few mentor doctors, or again, it could be in the office and you have those MCDs, the managing clinical directors, which are lead dentists, helping mentor and train you. So you're not just thrown into the wolves or anything. You have a whole training portion of, figuring out how long you need for treatment. So, we do provide that. So something to consider. A lot of times people think of us as a mini residency, as, Dr. Cost was saying with his new associate that started, she's realizing how, quickly she's learning. So it's a great program we have within Aspen Dental. So someone just asked, I guess this would be a situation. Is it a common path for an associate to work for Aspen for a few years and then go back and specialize? I guess, have you had that?
I suppose it's not unheard of. I don't know that I've had anybody in my group do that so far. My clinical directors, obviously, basically all the clinical directors that I have in my practices have been practicing for quite a while. Not to say you can't do that as a young person, if you have a lot of get up and go and, have a few years under your belt. But most of my clinical directors are, I think that the minimum I have is probably 5 or 6 years out. And then I've got the other ones that are 18, 19, 20, and I've got one that's a 30-year veteran. So, it just depends on, where you are with that. I will tell you that you're probably not going to be, regardless of what you do, you're probably not going to be super duper comfortable with everything, to the level that you want to be comfortable, just on a personal level, until probably between year 3 and year 5, out. Those first 3 years, really building that restorative base, really, learning to do procedures, learning to multitask, learning to manage, patient flow, learning to manage, employees, learning to manage, just patients that, some are harder to deal with than others, learning to actually sit down and be able to do some of the procedures while other things are going on, and managing your time, managing your schedule, making sure it's productive. All those things are things that are going to help you grow, not only as a provider, but it's going to help you build your repertoire, so to speak, of what you can do and feel comfortable doing those things. At this point in my career, there's not really a whole lot that I look at and I'm like, oh, okay, I'm doing that today. Okay, we'll go take care of that. You'll get to that point, but it's not going to be right off the bat. And ask for help. when you're fresh out, and especially if you're in a mentor-mentee relationship, or you've got somebody that's there with you that's got more experience than you, lean on them, ask them questions. I think that's important, at any level, where you're at. I'm sure you guys have some professors there, and if it's the same as when I was there, the people that were the adjunct professors that come in and actually work in the real world are the people that you actually lean on the most, because they're the ones that kind of get it, and they're the ones that have done it. And sometimes the people in academia that have gone straight from dental school and start teaching don't really have the understanding of what the real world, what it takes to do that. They know the didactic part of it. They know the way the dental school runs, but they don't know the way the real world runs sometimes. So those are, ask a lot of questions, to the person that you're with. Ask questions before you go, take a job somewhere. Make sure it's going to be the right fit for you. And sometimes it's just like, gosh, I remember coming out and it was like, oh God, I just want to get a job. This person's got a job already. That person's got a job already. Oh my gosh, is there going to be enough? Where am I going to go? What am I going to do? There's a lot of those questions, and sometimes it's hard to find those things. But you just got to make sure you're in the right situation for your comfort level and figure out if you want to push yourself.
Dr. Cost, do you allow for shadowing opportunities?
Oh, absolutely. Yeah. If anybody wants to come shadow, they're welcome to shadow. Like I said, I've got offices, pretty much kind of throughout the state. I'm here and there and everywhere in all of them usually, but the majority of my time right now is spent down here in the Barbersville area, just because I'm kind of here and close to here. But certainly, if anybody wants to come, or if they're on break or whatever, and they want to do that, I'm happy to have you.
Yeah, feel free to contact me, and I'll forward the information to Dr. Cost. Going along with your schedule and everything, do you work? Do you practice clinically, or are you just doing admin? Where are you at right now?
I do a little bit of both. I need to do more than what I do with the other stuff, but getting people in place and that kind of thing. I work every day right now, and I enjoy working. I love doing that. But I do have a host of doctors that work for me in the other practices. I travel to my other practices. I do a lot of surgery. I do a lot of implant surgery. I enjoy that. I've gotten good at it over the years, and enjoying doing those things, and can provide that service that some of the other doctors can't do. So I do travel around and do a lot of that. I do some admin as well. When it comes to that, and I like traveling the state and doing that kind of thing too. My parents are from up that way, so up there near Clarksburg and Morgantown. So I get to go up and see them as well when I'm up that way. But it's not something that I'm sitting back and not doing anything, because I do work. I do work quite a bit, but it's fun and I enjoy it. And I'm not old yet, hopefully. So.
Wonderful. So with associates, with a lot of fourth years, they want to know, what do you look for when you're interviewing an associate, especially a new grad?
Well, again, I think I'll go back to drive. When it comes to that, I don't think there's any wrong question to ask. If you go to interview somewhere, I think that would be, smart for anybody to do. I think, obviously they're the one that's offering you the job, so you don't want to, you don't want to go too crazy. But certainly, I think there's finding the right fit for the person that's hiring and the person that wants to be hired needs to mesh well, because if it doesn't mesh well, then there's no point in doing it, or that's going to end badly or whatever. So I don't think there's any wrong thing to say in those interviews, but I look for people that are driven. I look for people that want to want to learn and want to push themselves, and are interested in learning, certainly, so they can help grow, and I can try to help grow them. And the better they do, the better I'm going to do, the better everybody's going to do, when it comes to that. And the more patients we can help, and the more care we can give, and that kind of thing. It's super important to find somebody that that's going to be basically nice to the patients most of the time, is going to be a good provider, and going to be somebody that cares about their standard of care, and their making sure to do the right thing, and those kind of things. And again, where they're wholly owned by me, it's something that you don't have to go answer to somebody this or that. It's a doctor group. I've got a WhatsApp that I have all my doctors on, and we it's encrypted, so we can send a pan or whatever, that kind of thing. But people can ask questions, we can talk to each other, we can, whatever the case may be, we can just chit chat. You know, so you're going to have people to lean on that aren't necessarily just even the one person in your practice. You know, you're going to have, I think I've got maybe 10 doctors that work for me now, 10 or 11. So you're going to have, you know, lots of people, you know, with a multitude of experience to ask questions to, and have somebody that's there to help do that. But again, you know, ask questions, you know, talk about what you want out of life, talk about, you know, what you're trying to do, you know, what you'd like to grow with clinically. I don't think it's incorrect to ask about the money. You know, don't fear that, because that's, you know, obviously something that you need to, you know, set your life, you know, and to make sure that you're able to pay your loans and things like that. So, I can touch a little bit on the money if you guys would like to hear about that. I'm sure everybody wants to hear about that. The difference kind of between how, you know, how I pay my doctors and how, you know, any really Aspen is going to pay their doctors, is going to be from private practices. Again, we talked about the private practice. Usually you're going to get a percentage of your production, you know, after the insurance, and you're going to get paid on what you do, and that's what you're going to get paid on. Whereas any doctor that works for my practices is going to get a cut of the entire practice. Okay, so the doctors are going to get, it doesn't matter if, you know, you cut a crown prep and I place the crown, I don't care. You know, I mean, as long as the patient's okay with that. You know, continuity care is, you know, is good as well, but you know, if it can help a patient get in and get the crown on, whatever, it's a matter of what's right for the patient. You know, it's not a matter of, hey, that's my, you know, partial that I'm seating today, so that's my, you know, $1,200 or whatever. And this is, you know, there's a lot of that in private practice. You know, people will try to cherry pick things and pull things. I worked for a guy one time that I would do stuff and I found out he was taking it and putting it on his, because if you work in Dentrix and things like that, you'll get like a number as a provider and it'll put it to something else, because he was trying to get more money. And I had to go through the books and look at stuff and pour through. It was awful. It was not good. There's a lot of unscrupulous people out there. But you know, you're going to get paid. You basically are going to get a daily draw. You know, you're going to get paid daily, which we pay you pretty well. And certainly we can take individual questions on that after the fact, because everybody gets paid a little bit differently. But you get, you know, you get paid, you know, a daily draw, and then at the end of the month, you're going to get a cut of the entire practice. So if I come and I do, you know, 20 implants that month in your practice, and you're doing, you know, your clinical director's doing full arch rehabs, and you're doing fillings, you know, to build your restorative base, guess what? At the end of the month, you're going to get a cut of the entire practice. You're not going to get just a cut of your fillings, until you can get a little bit better to do. I was like, hey, I'm going to work with my clinical director, and I'm going to work, you know, you might work with me, and we'll just say, okay, this is how we're going to do this arch rehab case. We're going to teach you how to do, you know, to do those things. So you can sit down and have the time. You know, I don't know if any one of you says, hey, I'm super happy to sit down and, you know, cut, you know, 12, 15 crown preps at a time. Not that hard to do, but it may seem like a lot, you know, when you haven't done it. So, you know, to get that under your belt and to know how to do those things, you know, you get to learn that, you know, and you get to do those things, and then you get to be more productive as a dentist, and you get to help contribute to the practice, you know, more so. So it's good, because even if you're doing fillings and somebody else is doing something else, that allows them time to go do something else, you know, maybe to help the patients, you know, with the skill set that they may have, and to help grow your skill set at the same time. So I wouldn't ever say that you're going to have grunt work to do out there, because everybody's got fillings to do, everybody's got other stuff to do, but you're going to learn a lot of good procedures. You're going to learn to do, you know, some big stuff and some stuff to help grow your repertoire, as it were, out there. So that's the difference on how we pay, you know, people compared to how private practice pays people, and it makes it really nice for the patients and for the doctors, honestly.
Yeah, and then going along with that, you know, that contributing more moves you from an associate to becoming an MCD. It shows that leadership, it shows the skill, and, you know, as you're helping the practice, you know, why not move on to that? And with that, you the percentage increases with your pay and everything. So it's a good pathway. So going along with treatment plans, was it hard to get used to treating so many patients? And someone asked, can you really get to know each patient and have that personal level?
Yes, actually you can. So, you know, so if you get, you know, I'll use, since I've worked both, you know, I'll kind of give you the example. You know, if you're in a really nice, good high-end private practice, you may get about 16, 18 new patients a month. That's pretty healthy for that. They say that you want to have, if you're looking to say, hey, I'm going to go relocate to this town or whatever, they say you have to have, so many thousand people per dentist, in the town, that kind of thing, to know if you're going to have enough people to, be in your practice. But, you'll notice that some of these, private practices keep the same 1,500, 1,700 recall base of patients, per dentist out there for like ever, and then they get, 12, 13, 14, 15 new patients a month maybe. And by new patients, some people count just seeing an emergency, which is really not a new patient. But, we see, I would say my practices on average see probably in this, 7.5, 8 range a day, of new patients. Some of those patients are, they could be a denture patient, they could be, a full arch rehab patient. It could be anything that comes through the door, really. There's no treatment plan that's not doctor driven. Okay, there's nobody telling you have a quota to fill this or that. There's another office in the state that I won't mention that does have quotas on things, and they're not supposed to, but I won't mention their name. But but there's all treatment plans are doctor driven. It's between a patient and the doctor. It's sitting down, and you'll have full access to. When the patient comes in the door, I'll kind of go through our process here. They're greeted. The assistants will take them. They get a pan. They get a full mouth series. They get a set of bite wings. They go into the treatment room. We have iTero scanners in every office, so you get a 3D rendering of the person's entire mouth and their bite. You can move it around on the screen like an iPhone. Open up the arch. Move it around, turn it around, show patients. So it's pretty neat with that. The hygienist is going to come in, do a full perio charting on a new patient. So we have, just like you do in school, and you're going to sit down with the patient and you're going to talk to them, find out what their chief complaint is. You're going to find out, what their wants and their desires and needs are in life, and you're going to comprehensively treatment plan. So they have in front of them everything that's going on with their mouth, so they can make good informed decisions about their health. Is everybody going to do that? Sure, certainly not. There's people out there that, hey, I'm just here to get my teeth out, that's all I care about. Okay, fine, that's no problem. But we want to make sure that we're doing the right thing for the patient, to let them know that they have disease, where those things are, just like you do in school. You're going to, set things up correctly. You're going to do emergent treatment first. You're going to do your hygiene next. You're going to do all your restorative stuff next, and then, then you can do your definitive stuff like your crowns and your, partials and things like that. So it's no different than what you're doing right now. It's different in the respect that you're going to have a lot of people doing that stuff for you. You're going to have your assistants taking all the x-rays for you. You're going to have the hygienists that's there going to do all that stuff, so you don't have to perio chart anymore. You're going to have all those things at your fingertips, so when you can go in, you have all the information at your fingertips to make your diagnosis and talk to the patient, have a face-to-face conversation with them. The best thing I can tell you to do, sit down on the patient's level and have a conversation with them and listen. You've got all the stuff at your disposal to show them, especially the iTero, which is really nice because patients don't understand x-rays. They look like jack-o'-lanterns. They don't really get it. But with pictures, they speak 1,000 words, so you can show them those things. But, listen to their chief complaint, and you can talk to them about options, and try to explain it to them the best you can. Be there for them for questions, that kind of thing. That's really the best thing that you can do, is to have a conversation. A lot of people, when they very first come out of school, you're very much in dental school, you're very much didactic, very much, big words. And, I'm a fast talker even, but, if you're throwing out the big words, patients right over their head, no clue a lot of time. Now you don't want to, talk so dumb to them that they don't know what's going on, but you gotta talk to them about what's going on in their mouth, because don't be afraid to talk to them. You got to tell them what's going on, or they can't fix it. You're not going to go to your doctor and your doctor's going to be like, hey, I don't really feel like telling you your blood sugar is high, or I don't really feel like telling you got this going on. They're going to tell you what you got going on. That's what you got to do. So be comfortable in that, because a provider that is not giving people options, whether you do those procedures or not, a provider that's not giving those options is not a good provider when it comes to that. So it's really not hard seeing that many patients today. You have plenty of time for your your production, your procedures that you're doing. Most of my offices are 2-doctor practices, so it's really pretty easy. We have a lot of assistants that are really just excellent, and they're really, really good with the patients. And the place wouldn't run with just about everybody doing their individual job. And I try to thank my assistants every day, for helping, that kind of thing, and the front office staff, and everybody who kind of works together, to help the patient experience, be it a new patient or be it somebody you're doing a procedure on, or whatever the case may be. But when you have all those things at your disposal, it's easier to help talk to the patient. It's easier to help, have those conversations to give people options. It may be taking a tooth out. It may be doing a filling. It may be, doing arch rehab. It may be doing full mouth extractions. Maybe doing, all-in-4 implants and, hybrid denture. It could be lots of different things, so you got to find what's right for the patient and what they want to do. Never judge a book by its cover. I've seen lots of people that look like they're destitute, and had a guy my first year out in private practice, had on overalls, looked like he came out of a coal mine, and he lived in a trailer that he grew up in with his parents, and his parents passed, and now he lived in that same trailer. He owns a coal trucking business, and he's a multimillionaire. Never really cared about his teeth. He got them cleaned every time. He didn't really care that he had chips and breaks and stuff in them. This wasn't his thing. No big deal. He gave lots and lots of money to children's charities. He was very philanthropic with his money. You just never know. Just tell people what they have, talk to them about what their wants and their needs are, and figure out what's right for them, and be their advocate, be a patient advocate. That's what you're there for.
Definitely. You did speak about your dental assistants helping a lot. How involved are you with hiring office staff, like the hygienist, front desk, dental assistants, especially with having 6 offices, and then you also have ADMI helping. Are they picking? Are you picking?
No, I mean, mostly, I'm as far as on the office level, when it comes to the dental assistants and it comes to, some of the front office staff and things like that, I'll defer that to either my partner doctor, or, since he's a partner and a part owner, or the clinical directors in the practice that are going to be working, with said people every day. You got to make sure that it's the right people. Certainly, ADMI and my regional manager will, she travels around to the offices as well to help the front office staff. She helps, in the recruiting part of that kind of thing, and getting interviews and, kind of weeding out people that, may be flaky or this or that or whatever, to find hopefully the good people that are going to be there to help patient care. The bigger things, your laboratory technicians, your office managers, the doctors certainly is all me. I'm gonna make sure that I'm involved in those conversations and interviews and that kind of thing, to make sure we get the right fit. When it comes to that we have the right culture. When it comes to that. So, but there's a lot of good people out there. And you just got to find people that are willing to work and not necessarily work hard, because everybody wants to work hard. Well, most people want to work hard, but if you work productively, you don't have to work hard.
Definitely.
You can make, as far as money goes, you can make more money in an office in a month and see less patients than somebody that's seeing like 80 more patients than you in another office.
Right.
That are just running around like crazy, just trying to see people because, they did this wrong, or they did that wrong, and then they got to try to fix it, and they got to try to fix that. If you try to do something the right way the first time and take more time to do it that way, you're going to save yourself in the long run, because you're not going to be fixing mistakes when you do that.
Definitely.
So,
definitely.
It's about productive scheduling, and that's what the front office and even the dental assistants, we rely on them a lot of times to make sure that next procedures are scheduled and things like that. So we try to schedule things effectively.
Going along with front desk and dental assistants, when you treatment plan, are you discussing the treatment, or does the front desk do it? How exactly does that transition work?
So in a new patient scenario, after the hygienist, the hygienist certainly as a provider will talk to them about the periodontal condition and the health and things there, make recommendations and whatnot. You as the doctor are the ultimate person that sets that treatment plan. Okay, so you'll review your perio numbers, you'll review the x-rays and things like that, and make sure that that's the diagnosis that's proper. You're going to have the conversation with the patient about options and where to go. Well, excuse me, a lot of times you can feel out a patient a little bit, if they're hey, I'm not interested in doing this, I'm not interested in doing that, I just want my teeth out, or whatever the case may be. You're going to know how to set their treatment plan. Somebody, you may get those complicated people that say, oh gosh, I just don't know, some people will come in prepared knowing that they have something wrong. Some people will come in and they have no idea that they have something wrong, and they've got a mouthful of, not very good, a mouthful of abscesses or whatnot. So you have to have hard conversations with people sometimes. But once you kind of set the basis of the treatment plan, there may be option A, B, C, D, when it comes down to that. They're going to go to the treatment, coordinator, whether that be the office manager, whoever that may be, that's going to help them through the treatment plan, talk to them about the finances, talk to them about their insurance, because they're going to have their insurance information on file at that point. They'll be able to tell them how much, their insurance is going to pay, how much out of pocket might be. If it's a treatment plan that, they've got a lot of stuff going on, maybe they need, some help with that, then we offer care credit and a couple other, third-party providers that'll come in and help them do that, so they can just make payments on it, at no interest most of the time, so it's not, like buying a furniture set or something like that, if you wanted to. Every dental office in America has the same stuff, so it's not just Aspen. You can use care credit at the vet, you can use it pretty much everywhere. So, it helps people afford things, when they have things that need to be done. They may want the Cadillac and they may decide to do that. They may want not that, but the hardest conversation you're probably going to have is with somebody that doesn't know that they have a lot wrong, or may have gone to a dentist their whole entire life. And I will tell you this: don't ever badmouth another dentist. There's a lot of dentists that do that. Please don't do that. And that's not good for our profession. You don't know the situation necessarily that that person was in whenever they were getting whatever work that was done, and people will come in and they'll badmouth their old dentist like it's going out of style. They'll say, "Well, that damn dentist did this to me." Well, no, he didn't. The years of neglect that you've done after he did that restoration for you is what's happened to those things. Happened to your teeth or that crown or whatever the case may be. Be respectful. Don't ever badmouth another dentist. Don't, you can talk to the patient and redirect things, and you can say, this is what I'm seeing. When we see this is, generally sugar, acid related. This is, years of not keeping something clean. This isn't something that can happen that quickly, things like that. You will see a lot of shoddy dental work come through the door. You're going to see people that do patchwork dentistry, that have filled something to the high heavens, and there's fractures all over the tooth, and, have done endo that's half filled, and, abscesses in the mouth and things like that. And it's just, you just have to deal with it, and you have to focus on today and moving forward with the patient, and not about what happened before, when it comes to that. Because not everybody's a great dentist, just like not everybody's a great doctor, not everybody's a great, whatever the case may be. But, hopefully, we hold ourselves to high enough standard that we try to do the right thing for the patient. It's practice, it's not perfection. Don't think that you have to be perfect because it's practice, it's not perfection. The body has to do things. If you're doing endo, just doing endo on a tooth that has an abscess doesn't mean the tooth's going to be magically better. It takes the body healing that. Placing an implant doesn't mean magically you're going to have this implant that's just perfect. They fail. Things don't work in the world. Fillings don't work sometimes. Sometimes you put a filling in and somebody needs a root canal, so tooth hurt. Just things happen. Just do right by people and try to help the patient the best you can, and things will work out usually when it comes to that. So that's
no, that's perfect. Thank you. Now going back to you becoming an owner, how did you position yourself to get where you are?
Right place at the right time, I would say, probably. Aspen, as a company has been growing, over the past, how many years now? 18?
20, yeah.
20, yeah. So, it's just that, it started, basically up in New York, and it was a conglomerate of, group of practices and another group of practices that kind of got together. And that's how it started. A lot of people think it started in Colorado, didn't start there. It started in New York. They picked Aspen because it was in the beginning of the alphabet back when the Yellow Pages were a thing. And it just kind of grew from there. But, the brand is a really big brand at this point. We have 850 offices maybe now. I don't even know. We've got a lot nationwide. I think we're pretty much in every state at this point now. We've had a pretty big expansion here in probably the past 5 years. So I just was in the right place at the right time. West Virginia was kind of an uncharted state at that point. And, the years of experience that I already had in private practice and the procedures that I was, doing and I do a lot of procedures that a lot of dentists just don't do, just general dentists just don't do. So I was comfortable in those things and was able to come in and help manage and grow and own, and then helped bring more practices to, into West Virginia. The first practice I owned was in Kentucky, actually. And then I brought in practices to West Virginia. So, just the right place at the right time, really. But always, the experience and that kind of thing played a big part in that as well.
Definitely.
But
What's your biggest challenge owning multiple practices?
time.
Yeah.
That's a simple answer.
Right. That makes sense.
Not enough of it. So I've got 2 little boys at home also, so it makes it, I don't get to see them as much as I want to sometimes, and
Yeah.
it's tough sometimes, but I love them. So
Wow.
anyway, but that's that's a big part of being away from family and that kind of thing. But time in the practices, is mentoring and things like that, and spending other time on the practices, and mixing the procedures with working, I try to work with the office managers and the assistants and the other doctors when I'm up there as well, to try to help train and talk to them about I sat for probably 2 hours the other day in my Charleston practice going through with my office manager and my lead assistant there how implants worked, how so they would have a better understanding when they're talking to patients,
Yeah.
what was happening,
Yeah. No,
because they don't know. They're not clinical a lot of times.
right.
You get somebody that's an office manager, they don't know what you've been going to school for 4 years, to learn those things, right? They don't know everything that so you have to be able to teach somebody so it doesn't just stop at the room where it's like, oh, I know everything, I'm all knowing, I'm the I'm the wizard behind the behind the
Right.
whatever. And then they go up front and talk to somebody and they're like, oh, I don't know anything about this. You got to have people that understand and know those kind of things. So you have to help grow those things in the practice. So that I would say probably is try to take that knowledge base to all the practices, help grow the non-clinical staff as well as the doctors. That kind of.
Non-dental related, this will be my last question since we're hitting 9 o'clock almost. What do you like to do for fun? Outside of dentistry, since dentistry is so much fun.
I'd like to say like skydiving or something crazy. Honestly, right now, the kids are so small, I don't really get to do a whole lot.
Yeah.
Just hanging out with the fam and that kind of thing. I used to be really big into like mountain biking, road biking. Used to love to play some disc golf, like to play golf, like to play regular golf. I still do that somewhat. Just kind of, like watching football. So, it's a good time. Although this year stinks for football, but it is what it is. It's crazy.
I know it is.
I like
do you have any closing remarks? Anything you'd like to say to the students before we end the session?
The only other clinical thing that I would probably say is that I didn't touch base on and cover, and I like to cover, is when you get patients that come in, a lot of times patients are only focused on that one tooth, because that's what's hurting them at that point. That's great that you can help them with that one tooth. Okay, that's great that you can help them with emergent stuff. But if you think about your dental school career and what your comprehensive treatment planning that you're learning now is, don't go into the real world and become a limited exam dentist. Okay, and there's multiple reasons for that. It's not that you're trying to make more money. It's that you're trying to do the right thing by the patient. Because I will tell you, and I've had it happen when I've been in private practice, where somebody comes in and they're like, oh gosh, doc, this tooth is killing me. This tooth is killing me. You take a PA of that tooth and you look at them and you say, well, that tooth has an abscess on it. You got decay in the nerve on that tooth. Here's your options. Take tooth out, do a root canal, push corner crown on that tooth. We can make you a partial. We can, do all these things, right? Okay, well, gosh, doc, I want to save that tooth. All right, we're going to do a root canal, push corner crown. Let's go up front. We'll get you set up. All right, they get you set up. They put you on schedule. You do your root canal, your push corner crown. Haven't worried about hygiene yet. That's an obvious mistake, when you're getting ready to do crown, right? You're not following the protocol already that you're learning right now. And then you say, okay, well, we got you out of out of pain on that tooth now. Now we're going to come back and we're going to comprehensively, bring you in as a new patient. And you take your full mass series and your pain and all that stuff, and you realize, oh gosh, well, you got 8 abscesses on your maxillary arch. Oh gosh, well, you maxed out my insurance doing that one root canal and the crown there. Oh, well, what do I do now? It's like, well, here's your options. We can do 8 root canals and crowns, and we can, do all these fillings that need to be done. You've got SRP that needs to be done. Oh my gosh, well, I can't afford all that. And I can't do this and I can't do that. And I don't have a job and I can't get credit and I can't, so what are you going to do? Maybe that person should have, had other options at the beginning. And if you would have taken the time to comprehensively treatment plan them and talk to them about options at the very beginning, maybe they had a choice of a denture. Maybe they had the choice of a partial. Maybe they had the choice of, again, all the crowns and bridges, or maybe they had the choice of taking teeth out and doing, 6 implants on top and doing a hybrid denture, or whatever the case may be. Lots of different ways to do that. But regardless of the monetary part of it, whether it's, pulling or if you can give them a denture or doing full mouth rehab on them, there's a way in a treatment plan for that patient. And if you focus on limited exam dentistry your entire life, and a lot of dentists will do that, you're not going to be a good provider. So that clinically, that would be what I would suggest to you, is to make sure that you're somebody that follows the proper way to do things, just like you're learning right now, when it comes to that. And then, just general closing remarks is, I would say try to grow yourself, try to challenge yourself, try to, push yourself to do more, especially if you have somebody that's there to help you kind of, catch if you fall, because that's the way you're going to grow your career. That's the way you're going to learn to do more things. If you're don't like doing those things, no big deal. If there's a procedure you don't like, don't worry about that. If you really truly hate doing endo, don't do endo, if that's the case. But, grow what you're good at and what you like, and challenge yourself to do more, maybe the things that you're not so good at, so you can learn to do better. And that's going to help you.
Awesome. Thank you, Dr. Koss. That was great advice, good closing remarks and everything. I just want to say thank you to everyone for attending this. You should have my email address. If you have any interest in shadowing, like Dr. Koss said that, he could make that work in some of his offices. But again, if you have any questions for me or anything you'd like me to forward to him, just feel free to email me and I'll get you guys in contact. But other than that, thank you again for joining, and have a good evening. Thank you, Dr. Koss, again.
All right. Thanks, guys. Appreciate it.
Thank you. Bye.